To start with, what is registration of health practitioners? I think that is where we should start, so that those that are just graduating should understand that this is what we are talking about. So what is registration of health practitioners?
Thank you, Mwaka. Yeah. So I think I'll make it very simple. Registration of health practitioners is simply a formal recognition by the Health Professions Council of your knowledge, skills, and competences that will enable you to put those into practice.
Great.
Yeah.
Why is it important? I know you said it will enable you to practice, but why is it important to register with HPCZ? I know there's always this question that why should I register with you? I've already done my training, so can I just go ahead and go and practice in any facility that I wish to practice?
Okay. So in a number of interactions that I've had with people, I always give this example. Think of it as somebody who is driving a vehicle and they're out there on the road. For you to legally drive the vehicle, you need a driver's license. Otherwise, you always be looking out for where are the traffic officers. So registration with a council, first and foremost, protects you as a health practitioner. You spend 4 years, you spend 6 years, you spend 7 years undergoing training. That investment has to be protected. How is it protected? By registration. So when you register, somebody who has not gone to medical school will not wake up today and claim that they are a doctor, because you who is registered and that person who is not, who hasn't undergone formal training, you are at two different levels. For you, because you have a legal document, the law protects you. For that person who doesn't have a legal document, we find them, we arrest them. So your skills, your knowledge are protected by law. Additionally, for the people that you are giving the service to, there is that assurance that that document that you have confirms that you have adequately been trained and you are skilled in your trade.
Thank you so much. Now, who is required to register with HPCZ?
Thank you. So the Health Professions Council of Zambia is created by an Act of Parliament. So this Act of Parliament, which is law, defines who can register. So certain professions, like I've said, are protected by law. So if you want to practice as a doctor, you require registration. If you want to, so the majority of the professions that practice in the hospital, with the exception of nurses, are required to register with the Health Professions Council of Zambia. That is what the law provides for.
We've had people coming, those that have done psychosocial counseling, asking if they are also required to register with HPCZ.
Thank you. So psychosocial counseling is not one of the programs that we register as the council. So maybe in view of that question, I'll need to explain the process of how a profession is recognized. So there's procedure. The Act has provided for the minister to prescribe who should be registered with the Health Professions Council of Zambia. And only those professions that are prescribed, I must be quick to mention that in as much as maybe today that program, that profession may not be registrable with the council, tomorrow if the minister prescribes that this profession can be registered with the council, it means they can start registering. But at the moment, it is not one of the professions that has been prescribed under the Health Professions Act for registration purposes as a health practitioner.
Okay, thank you so much. I hope they got that. Now, take us through the types of registration. I think that is where we have a bit of a challenge. Yes.
Okay.
Because some people do not know at what point, what do I register for when I just complete my training?
Yes.
Or I've worked for so long. What am I supposed to register for? So run us through the types of registration.
Thank you. So your career as a health professional starts at training. The very day that you decide to enroll in a health-related program that requires registration with the Health Professions Council of Zambia, that's the day that your career starts. So the very moment that you have been enrolled and accepted in a training institution and you've commenced your training, you are required to register as a trainee, the so-called student indexing, because for us, your journey has begun as a health professional. So during your training, you'll be registered with a council as a trainee. Okay, so if you are doing medicine, you'll be registered as a trainee undergoing medicine training. When you complete your training, there is a register that you migrate to. From trainee, you now be registered on a provisional registration. Okay, so that's the second register that you migrate to. So you need to follow me through in terms of the journey. Mm-hmm. So you start as a trainee, yeah, on the trainee register. From trainee, you graduate to provisional register. So this provisional register is meant to facilitate, to recognize that yes, you've qualified, but you are not fully baked to work independently. So when you are placed on the provisional register, we say, okay, you can work, but you need some supervision. So for a minimum of 1 year, you'll be undergoing what we call supervised practice. Okay. So after 1 year, we expect that you've gained enough competence now to operate independently. And look at it like a driver. Before you are given a license to drive independently, you first have to get provision. And during that period, and here I'm not talking about those that buy driver's license. I'm talking about the legal process of obtaining a driver's license. So you'll be learning how to drive under an instructor. So you have a provisional driver's license. So similarly, in the council's perspective, you are given a provisional registration certificate to recognize you as somebody who has graduated and is undergoing supervised practice. So after 1 year, you are supposed to migrate now to a full register, which is a permanent register as a health professional. So that register now means now you have so much responsibility vested in you to practice independently without anybody following you. You've done that, you've done that. So the responsibility somehow becomes bigger. So that is the third register. So I've talked about trainee, talked about provisional, I've talked about full. So there is a fourth register in your journey that we expect you to move as you gain more knowledge and skills, which is a specialist register. Mm-hmm. So I am a doctor, a general practitioner, I graduate. Now I want to just become a pediatrician, only a doctor that is specialized in looking after children. So you go and do your M.Med, your Master of Medicine in Pediatrics. You come back, tell us, I've graduated and gained these specialized skills. We'll migrate you to the specialist register for pediatricians. There are two more registers that I haven't mentioned. So this is basically the journey. But the two more registers I need to mention are for colleagues that are coming from abroad. If you are trained and registered outside the country and you want to come and practice in Zambia for not more than 6 months, there is a register where we will place you, which is a limited register. So this register is only for those that are registered outside. They are registered in the UK, you are registered in China, in Botswana, South Africa. You are coming to practice in Zambia from day 1 to month 6. Not more than 6 months. We'll place you on a limited register. However, if you are registered outside the country and you want to come and practice in Zambia for more than 6 months, the law also provides for a temporary register. So that is the, I think, the 6th register that I can talk about. So limited and temporary are for our colleagues that are registered abroad and they are coming to practice in Zambia, either temporary or permanently. However, when you are placed on a temporary register, you are expected equally to migrate to full register if you are coming permanently. That is after a minimum period of 1 year.
Okay.
Yeah.
We move on to our next issue. This is with documents now.
Yeah.
What documents are required for first-time registration? And this one is for locally trained, because we would like to believe there are different documents that people submit. Let's talk about the locally trained practitioners. What documents do they submit when applying for registration?
Okay, so I need to make a clarity here. Prior to the enactment of the Health Professions Act number 17 of 2024, if you're a fresh graduate trained locally and a fresh graduate trained abroad, you were being placed on 2 separate registers. So locally trained, you are placed on provisional. Foreign trained, you are placed on temporary register, sorry. So there's been a bit of change in the act, in that now, for as long as you're a fresh graduate, regardless of where you were trained, for as long as you're a fresh graduate, it means you'll be placed on a temporary, on a provisional register. So in the new act, the temporary register is reserved for those that are registered outside the country. So in a nutshell, all fresh graduates are placed on a provisional.
Have we started implementing that?
So the only issue that is there is a issue of legs. Okay, I know there are a lot of questions around that subject.
Exactly.
So the moment legs is introduced, then that implementation will happen.
Okay.
Yes, because legs is a equalizer of whether you are locally trained or foreign trained. Right now, the locally trained are exempted from the legs. However, the assessments as envisioned by the Act, it has continued. So that hasn't been implemented because foreign trained require the assessment that is prescribed in the Act. So they are being placed on a provisional, temporary registration. So going back to your question, what documents are required for locally trained graduates? I mentioned that as a trainee, you are expected to be on a trainee register. So that means at the time you are training, we will have received your grade 12 certificate, we will have received your NRC, okay? As well as the admission to know where you are training from. So you are already in our system. So when you graduate, what do we expect from you? At the moment, and I need to emphasize, at the moment, what we expect from you is a detailed transcript from your training institution. I need to emphasize this. Detailed transcript. People ask, why do you ask for detailed transcript? The detailed transcript shows us your progression journey from your first year of enrollment to your last year of training. Okay? So, if you did some mathematics in between here, you colluded with some training institution, you moved from one training institution to another, and then for some reason you are fast-tracked without following the due curriculum requirements, this is where we catch you. We will not be able to proceed with your registration if there are gaps. So detailed transcript is required at the first time registration.
Not the diploma certificate or
no, if you have it, you can submit it at first time, but we do not expect you to have it immediately you finish, because some institutions have graduation ceremonies later, and that's when you have. So we do not require you to submit a diploma or degree at first time registration. If you have it, you can submit it, but it has to be accompanied with the detailed transcript. Okay? So the diploma, if you have it, does not substitute for the detailed transcript. Yeah. So other than that, if you are submitting your application physically, we are still receiving applications physically, it means you need to also submit a duly completed application form, which has to be certified by a commissioner of worth. If you are submitting online, you do not require to submit an application, because the form that you fill in online itself is those details as you are filling in, that is a form in itself.
Okay.
Yes.
Okay. Thank you. Now let's go to foreign trained.
Yes.
What documents do they submit? And as you explained that, maybe include the part where we need to have their results or whatever documents they have equated to the Zambian system.
Thank you. So, if you are foreign trained, it's highly likely that by the time you are coming to register, you are not registered as a trainee when you are undergoing your training. So, the first thing that you are supposed to do as a foreign trained is to do your trainee registration. Okay? So, at trainee registration, what do we look for? We look for your grade 12 or equivalent. If you did, let's say, Cambridge, for example, Cambridge at grade 12, that Cambridge has to be submitted to HPCZ for equating. So whichever secondary school exit exams you did from whichever jurisdiction, the competent body to equate that is the Examination Council of Zambia. When the Examination Council of Zambia equates that and brings to us, then we are able to now do the trainee registration as per our requirements. So when you successfully register as a trainee, then you need to have your qualification now verified and validated by Zambia Qualification Authority. So once you do these two, then you qualify to receive a referral form for assessment. Currently, assessments are being conducted at Levy, Mwamba Medical University. So we'll give you a referral form to refer you to Levy for assessment. When you qualify, when you successfully pass the assessment at Levy, then you are ready to come and register as a health professional. So we expect a copy of the assessment results from Levy, notwithstanding that they do share with us the same copies as a way of verification that you have undergone. You did not obtain that assessment from Material University. Then, of course, we will need certified copies of your diplomas and your degrees. So if you are foreign trained, in addition to the transcript, detailed transcript, we require the certified copy of your diplomas and your degrees. Okay? Mm-hmm. Yeah. And the application form, if you are submitting physically, or the completed online application form, and a passport size photo with a clear background.
Right.
Yeah. And of course, the payment. the applicable fees.
Okay, great. Thank you.
Yeah, that also applies to first. The fees, every application has got a fee attached to it, depending on your qualification.
All right, thank you.
Yeah.
Before we get to our viewers, we need to get their comments, their questions. I would like to ask you one more question.
Yes.
We should have asked it earlier when you were talking about the types of registration.
Yes.
What are the steps involved in transitioning from provisional registration to full registration?
Thank you. I think I briefly touched about this. I said when you are transitioning from provisional to full registration, there's a critical requirement of undergoing minimum of 1 year supervised practice. Okay? So, I think I need to explain a little bit more on this one, because it's pointless to, So, supervised practice does not mean employment. It just means that practicing under supervision. So currently we have a challenge in our country where the output from training institution and the uptake by the employers is not matching. So we have a lot of unemployed graduates. So I'll give you an example. You are a doctor. You've undergone your 6 years training. You graduated. You are and you register on provision. For you to work independently, you need to transition to full registration. For you to transition to full registration, you need to undergo 1 year internship in approved internship site. So meaning you can't just go to any hospital and say, I'm doing internship. It has to be an institution where they are the minimum 4 specialties in terms of internal medicine, general surgery, obs and gyne, and pediatrics. When you rotate in those 4, and the supervisors confirm that you can work independently, then you can come and do full registration. After you get full registration, then you can work anywhere, NGOs, clinics, wherever, private, and everywhere. So, supervised practice, for those of you that would want to make progress as you are waiting to be employed, I would encourage you to volunteer for this period to enable you practice and gain and meet the requirements for full registration. Because when you're on full registration, it unlocks a lot of opportunities out there.
Okay.
So, what do you require to transition? You require to show that you have undergone supervised practice for that minimum one year. For those that don't require internship. For those that require internship, with the exemption of direct entry medical licentiates whose internship is 18 months, the others, you are supposed to undergo the internship in approved internship site. So a supervisor has to certify that you've undertaken the supervised practice or the internship. Secondly, the head of that institution where you are doing the supervised practice or internship also has to write a letter to confirm that indeed you did that supervised practice or you did the internship and you've been certified competent. Okay? Then you need to submit the certified copies of your diplomas or degree. I need to emphasize here. So here, whether you are locally trained or foreign trained, it is a must submit. We do not accept transcripts at full registration. I emphasize, we do not accept transcripts at full registration.
Only at provision.
We require, yes, only at provision. We require certified copies of diplomas, degrees, certificates. Yeah. So those are the critical documents I need to mention, not forgetting the application form, the completed application form, the prescribed fees that are required for you to pay.
Okay, great.
Yeah.
Thank you so much. And I'm glad that you've clarified on the part of practicing for that period for you to get your full registration. There's always the question of, I'm not employed. Actually,
Yeah.
that's the question that comes. I'm not employed. So it's good you've clarified that you can be unemployed, but still practicing somewhere.
Yeah.
You're still required to go through that process. Thank you so much.
Yeah.
Okay, let's get to the comments.
So maybe before you move, I also need to mention that when you register and for some reason, maybe as a result of that unemployment, you still don't want to do your volunteering, there is an option for you to apply to be placed in the non-practicing status on our register. But it's a bit problematic if you are still on provision. Okay? If you are still on provision, it's a bit problematic because you may find that by the time you choose to come and reactivate your registration, requirements may have changed. Okay? Maybe you may be required to undergo some form of assessment. Because remember that the whole reason why you are being placed on a full register is to confirm that you've acquired the skills. So we've been receiving these requests, place me on non-practicing status. It's whilst it's good because you will not be accumulating the arrears, such that at the time you want to come and reactivate, you simply pay the applicable fees at the time. So I needed to mention this to tell our viewers that we do have that option for somebody to apply to be placed in a non-practicing status to avoid arrears accumulating towards your registration and practicing certificate.
Thank you for that clarification. That question always comes.
Yeah.
Can I have my license suspended just for a certain period? So it answers that question. Now, the comments, Nangala HMOG says, I need to do my specialty registration. All needed documents are available and I also want to be indexed. I'm currently doing MBCHB. This is just a comment, obviously.
That's a bit confusing. They want to do their specialty registration, but they're doing MBCHB. So, specialist registration, you only qualify for specialist registration if you have a qualification at undergraduate and you are registered, fully registered at that undergraduate degree. So if she's still in training, let her do the trainee registration, which is student indexing. And when she graduates, we'll place them on provisional registration.
Thank you. Another question, this is from Muya Andre. Says, how long do you take to get back to those who apply online? For faster approval, which one is recommended, online or physical? Mr. Mwamba, this question.
So, look, in our council charter, we have committed ourselves to process an application within 2 weeks. So, depending on circumstances, which differ from applicant to applicant, there are some applications that may take a little longer. There are applications that take 2 days. What factors contribute to this? We have a situation, you have graduated from University A, okay? You submitted your application, you have all your documents. But on our end, our internal processes require that we confirm that you graduated from University A.
Okay.
So how do we confirm that? We require a pass list submitted by University A. So if your University A has not submitted a pass list, that may contribute to the delay in your application being processed, because we now have to go back and forth with University A to submit the pass list. So this is the whole reason when we resume our legs, we expect these turnaround times for these applications to be more like uniform, because all candidates that qualify for registration, we will have examined them. So the pass list sits with us. Okay. So you apply, you are meeting all the requirements. Within 2 to 14 days, your application should be approved. So it is on a case-by-case basis in terms of I can't say online is faster, physical is faster. It depends on your circumstances. Okay. Because there are circumstances that applicants submit incomplete documents online. We have to engage these applicants to submit those documents. Yeah. Okay.
We only have less than 20 minutes to wind up. Let's get to some more questions. This is from Semo Given. He says, when we are trying to apply for licenses online using the portal, the response is that we owe HPCZ money, yet HPCZ deduct from our payslips every October month. What could be the problem?
Okay. So, the deduction, I will encourage those that are on government payroll to prepare yourselves. In fact, we have begun renewing licenses for 2026. So we are hoping by now you are ready with your CPD points. Okay? So when such circumstances happen, in most cases, it's because you missed out renewing for a particular year. So the system is recognizing that you are not compliant in a particular year. Maybe this is what, 2025, you are trying to renew for 2026, and yet you didn't renew, there's a gap on your record, you didn't renew maybe 2023 or 2022. Such things are bound to happen because you did not, whilst you were deducted, you didn't proceed to submit the required CPD and obtain the practice license, meaning there's a gap in your annual practicing certificate history on the system. Mm-hmm. Yeah, so that requires harmonization. Yeah.
Okay. This one says, I think this is, I'm not sure you're able to answer this one. Approved internship sites, do they start from general hospitals or central hospitals only?
So, currently, actually, the ministry, in trying to improve the human resource for health, is trying to increase on the number of approved internship sites. You are aware that especially for internship sites for medical doctors, you require the 4 specialists that I mentioned. So the ministry is working towards rolling out, increasing the specialists in these hospitals. So general hospitals, there are general hospitals that are internship sites, provided they have the minimum 4 specialists that we are talking about here. So what determines the qualification of a facility as an internship site is meeting the requirements for an internship site. Okay. There are hospitals like Medland, that's an internship site. It's a private. We have most mines under Mopani, mine hospitals under Mopani, which are internship sites. So in a nutshell, it requires an institution meeting the requirements for being an approved internship site.
This question here, please clarify, Mr. Mwamba, from Dali Somwale. It says, I found the program halfway. So you mean you can't get a job under provisional registration? This question is under clinical medicine general who undergo 9 months clerkship before graduating.
So under provision, you can get a job. However, where you have to be employed, there has to be a supervisor, okay? And this has to be a peer. So if you are a clinical officer general, the place where you are going to be employed, there has to be at least a minimum of a clinical officer general who is on full registration, or a medical doctor who is going to supervise you. But yeah, so in a nutshell, you can get employed when you have provision or as a clinical officer general. If you are a medical doctor, you can also get employed, provided where you are being employed as an intern is an internship site. I've given an example of a few private hospitals that are internship sites. You can get employed there. So if you want to get employed in the private and you're a medical doctor, if that facility that is employing you is not an internship site, then they are abrogating the law. Yeah.
We have a question from Elias Chivale. I've been away for 2 years and I haven't renewed for a while now. What's the procedure? Am I going to be charged?
So, whilst you haven't mentioned where you were when you are away, whether you are abroad or you are locally and away from practicing, the section 24 of the Act provides for you to notify the council before. I need to emphasize, before you go away. So let's say you are going to England and you'll be away for 2 years. Before you leave, we require you to notify the council that I will not be practicing for the next 2 years. When you notify us, we will place you in the non-practicing status. So when you come after 2 years, you simply come and pay the fees and apply for the annual practicing certificate. However, there's a requirement for continuing professional development. So you pay, but you need to submit the CPD that in this period that you are away, whilst you are not practicing, you were undergoing continuous professional development. So we'll give you the practicing license. But if you were away, you didn't inform us for that 2 years, you first need to clear the arrears for that 2 years and then submit the CPD form, and then we'll give you the practicing certificate.
Lemi Longo is asking, is it mandatory for locally trained to verify with Zaka? Zambia qualification.
So, under the new law, both at Zaka and HPCZ, it is mandatory. However, currently, we haven't yet implemented that, okay? Because there are a few regulations that we are working on, which as soon as the minister signs, it will become mandatory for you, when you graduate, to submit a verification report from Zaka.
Okay.
Yeah, so we are not asking for them at the moment, but the law has changed. Once regulations have been signed to actualize that, it will be mandatory very soon for you to submit Zaka.
Then there's someone asking about CPDs, the online platform that we had posted some time. They're saying it doesn't work. How do they go about accessing online CPDs?
Well, it will be good to understand what challenges they are facing with that online CPD, but that is not the only option that you have. You have various options locally that you can accumulate your CPD. We have professional associations like COAS has developed a robust CPD program. You could accumulate and gain your CPD points through your professional associations. There are various webinars, clinical meetings that I believe happen in these institutions that you can attend and attain these CPD points. Currently, a clinical meeting earns you 5 points. So if you were just consistent with attending clinical meetings, by mid-year, you will have attained the 100 CPD points that is required, because most of these institutions hold clinical meetings on a weekly basis. So which means if you are consistent with attending the clinical meetings, just from clinical meetings alone, you can earn 20 points in a month. By May, you have your 100 CPD points.
Okay.
Yeah.
And if I am upgrading, for example, from a diploma to a degree, what happens with CPD points? Am I getting the whole 100, or it's 5%? It's 5 points as well?
So under the current framework, just by virtue of you being in school, it gives you an automatic 100 CPD point. So all we require is either your HOD or your lecturer to sign that CPD form to confirm that you are in training, and that will suffice, and it will be proof enough with a stamp from the training institution that you are in school. Yeah.
This is from Wilson Yason. He says, does the recommendation letter for getting a full registration expire, or it has a duration when it becomes invalid?
Okay.
I got it 6 months ago, and then I decided to come for full registration today. Does it still?
Well, that recommendation letter doesn't expire, but I'm wondering, why would you sit with a recommendation for 6 months?
I didn't have money, Mr. Mwamba.
Okay. No, the recommendation letter doesn't expire.
Okay.
Yeah.
Thank you very much. This one, I'm not sure I understand, but maybe you understand. It's from Remy.
Yeah.
It says, when you deduct next month, am I supposed to pay the whole when registering for a degree, or you will deduct the 620 for diploma?
Okay.
It looks like they're upgrading. They want to change.
So I believe that person is currently upgrading. So under the current guidelines, what we do is, if you are registered as a diploma and you pay your fees for the annual practicing certificate, we do put that payment into consideration when you come to register for your degree. Yeah. However, I need to emphasize that it also depends on your compliance level. If, for example, by the time you are coming to register, there are people that have children, you are on provision, you go into school, you are on provision or on diploma, you go into school, one, you are not renewing your practicing certificate, two, you have not migrated from provisional to full. Then you just come that I finished my degree, register me. So we will first require you to normalize your registration as a diploma. Meaning, if you are not renewing for 4 years, we will require you to first apply for full registration, permanently register a diploma, then pay the arrears for diploma, and then that's when you qualify for registration at degree.
Okay. Natasha Sankananji is asking, I'm a nutritionist with a provisional license. Am I still required to collect CPD points? By the way, Mr. Mwamba, please explain, what are the exemptions on CPD points? As you're answering Natasha's nutritionist provisional register.
So currently, there are a few that are exempted from CPD. These are lecturers under the current guidelines. Okay? Lecturers and specialists. Everyone else is required to submit CPD points. So, Natasha, you are required to accumulate 100 CPD points.
Okay. From Musumali Matthews, what did you mean on non-practicing status with regards to any changes or assessments? Do you get that? So currently there are no assessments applicable when you come to reactivate after you apply for to be placed in a non-practicing status. What I was cautioning was that these regulations and guidelines change over time. So if you are on provisional registration, it is best for you to ensure that you get your full registration as soon as possible. Then if you want, that's when
you apply to be placed in a non-practicing category, because now you are fully registered and you are certified competent. Now, if you are on provision, it means you are not yet certified to stand on your own. So we are looking at a situation where you want to apply to be placed in a non-practicing status and yet you are on provision. Then maybe you come back 10 years later to say, now I want to start practicing. You may find that because of the duration you graduated, registered, then you went inactive. Medicine is a hands-on profession. So you will not tell me that by the time you return 10 years later, you still have the few skills that you had acquired while in training. So you may find that you may be subjected to some form of assessment. Not that currently we are doing that, no. I'm just trying to push in a caution to encourage practitioners that are unemployed to at least try and get the full registration, which is a permanent registration. After that, if you wish now not to practice, then you apply to be placed in a non-practicing status. Yeah.
Mr. Mwamba, you have 30 seconds to give your concluding remarks. I know that you always monitor our Facebook page and you see the concerns from practitioners. So your concluding remarks in 30 seconds.
Thank you. So first and foremost, I would like to thank you for your time. We value your time. We know you have a lot of other important things to attend to, but you spared your time to be with us and listen to us. We do see your concerns. We do listen to your concerns. It's just that sometimes we get so overwhelmed to respond to each and every concern, but we do get the concerns. And we are working on improving our systems for us to be able to give you a service that you'll be happy with. In a nutshell, as registration, we want to encourage you to, if you are a qualified person, come and register. Your profession is protected when you are registered. Should you be aware of an illegal practitioner there, as a registered health practitioner, you have a mandate under the Health Professions Act and the Code of Ethics to report such people. Because remember, when you report, not only are you helping us protect your profession, you are also protecting the human life that you saw to preserve. So help us so that we can also enhance your profession. Thank you.